Welcome to Adapt NCLEX. Select or apply. SATA and prioritization are two areas that you have to master for the NCLEX and nursing school. It's a big problem. When they put it together, how do you tackle it? By the end of this video, you master them. I'm calling this fundamentals of select or apply and prioritization. Straightforward. Some questions, high yield, stick around. Let me help you master this concept. First question. The question usually starts with the easy one, then we progress with the harder and harder, and you see how I change the form. One question in front of you is a select or apply, but at the same time, prioritization. You don't have to pick everything. When you see SATA prioritization, look at each individual case as one. Don't compare to the other one. Think about it. If I see one patient with this problem, what would I do? That's all. That's the concept. Strategy. Select or apply. Which finding must be reported immediately to the provider. What do you think? A nurse is aware of several clients after change of shift. 5 patients provided to the nurse. Which one would the nurse report to the care provider? Severe back pain on Enoxaparin. Shoulder pain after laparoscopic cholecystectomy. Dark urine on Metformin. Confusion and diaphoresis on insulin. Mild edema on amlodipine. Stop the video, put down your answer in the comment, think about it, and then proceed. What do you think? Which answer choice did you pick? If I'm taking the test, this is the way I will analyze the question. And this is the NCLEX strategy. First, I know it's a select or apply. I know it's a prioritization too. I need to report it after I've been given 5 patients. That's the concept. That's the question. Now, look at each other question. Patient and severe pain. Is this what I expected? My prioritization strategy, I said, be sharp, not expected, where B is the breathing issue, E is electrolyte, S, shock, H, what? Hypothermia, hypoglycemia, A is airway, R is neurological, and pain. We have a patient complaining about pain. Is this pain going to kill this patient? Yes. This kind of pain is not just any pain, it's a bleeding pain because this patient is on Enoxaparin. That's the first thing. So this patient is an hemorrhage. In actual fact, it's not the pain I'm worried about. I'm worried about the S, which is the what? Shock in the B sharp. I'm seeing this patient. Shoulder pain after laparoscopic cholecystectomy. This pain is not going to kill you. My P pain, I mean pain that is going to kill you. Shoulder pain after laparoscopic cholecystectomy, expected finding. Dark urine on Metformin. Metformin causes lactic acidosis. When I see dark urine, what is happening? Rhabdomyolysis, muscle pain. What is going to happen? It's all related to shock, and the individual is going to be in trouble. We go in heart failure, all these problems. That's the problem. I'm seeing you. Confusion, diaphoresis on insulin. When you take insulin, you should not have confusion. You should not be sweating. That tells me you have what? Hypoglycemia. H, hypoglycemia. I'm picking you. Edema on amlodipine. Amlodipine is a what? Calcium channel blocker. It makes your vein bigger. Blood go to your leg. You have edema. Unexpected finding. I'm not picking it. You see how I do it? All of them. That's the way you approach it. Therefore, our right answer is A, C, and D. These are bad problems. We need to take care of it fast. Same thing. Select and apply, SATA question, then prioritization question. NCLEX prioritization. Which client need priority assessment? And nurse is caring for several clients. One, client with diabetes. I hear what? I see what? I feel what? Fruity breath. A client with what? Who is postpartum with the firm uterus. Client with atrial fibrillation and irregular pulse. Client with osteoarthritis as what? 7 out of 10 knee pain when walking. Client with what? Severe hypertension and a headache. Which one you should not expect that in the individual? And which one you should expect? Don't make it hard. Go for the buzzword and go for the B sharp. Stop the video, pick your answer choice, and let me know. But I know you picked the right answer, and I know which answer choice you pick. If I'm taking the test, this is the way I approach it. Prioritization, select and apply. Analyze each one. Diabetes patient, you should not have fruity bread. If you do, you have DKA. Postpartum patient, your uterus should be what? Firm. If it's boggy, you're bleeding. This is not hemorrhage. Atrial fibrillation, you should have what? Irregular pulse. I'm not worried about you. Osteoarthritis, when you walk, you should have pain. Well, 7 out of 10 is bad, but your knee is not going to kill you right now. The thing is prioritization. Don't be nice. Because it's pain, you're going to pick it. Walk away like the patient is walking. Client with what? Severe hypertension and headache. You have hypertension, fine. But when you have headache, that's urgency. We're going to see you. You know the point. You know the strategy. So A and E are bad problem. We got to see them. Which client should the nurse recognize as being at highest risk of acute complication? That means, I put a bunch of language there. It's the same thing. I'm using risk reduction. I know you hear people talk about risk reduction. This is big. This is the way the question is. Prioritization. They change the word and they put a bunch of words there. It does not change the fact that the client is at highest risk for acute complication. Means you should prioritize this individual. That's all. After a change of shift, which client should the nurse recognize as being at risk of what? Highest risk of what? Complication. Like I said, it get harder. That's the language. Don't say, I don't understand it. This is prioritization. And it's the same thing as select or apply. Client with what? Nephrotic syndrome. What is the problem? He has leg pain, leg edema. Client with diabetes, insipidus, making a bunch of urine, high urine output. Client on what? Insulin glargine, he has tremor. Client with what? Asthma, wheezing when he's using the inhaler. Patient on digoxin, he has nausea. What do you think? Stop the video so that you can keep your score. And I would like to know at the end, put it down, which one was trappy for you. Look, nephrotic syndrome, you're going to lose your protein. Edema, expected. Diabetes insipidus, you cannot hold on to what? Your water. You lose it because you don't have ADH. Don't worry about them. You are on glargine, insulin, and you have tremor. I'm worried about you. Hypoglycemia. I got to worry about you. You have asthma. I expect you to wheeze, but you're being treated. Inhaler. Good. Digoxin, GI symptoms, bad. I'm picking you. Only 2 answers. If you overselect, you get 0. That's the purpose of this selection, so that you can understand fundamentals of prioritization and select or apply SATA question on the NCLEX. And then is reviewing assessment findings for multiple clients with cardiac condition, which finding are most concerning. You see the word most there is a prioritization, concerning. Bring your cardiology concept. If you need more, I have a video, 85 questions on cardiology, or check my YouTube channel, a bunch of cardiology questions you will never forget. You will learn this all cardiac conditions. A client with aortic stenosis, what does the patient have? Harsh systolic murmur at the right sternum border. A client with aortic stenosis with the chest pain. A client with aortic aneurysm with the blood pressure 105/80. A client with coronary disease prescribed Sumatriptan. And a client with coarctation reporting leg pain when walking. Is all unexpected finding or not? You have to bring your concept and ask yourself, should I see this patient? And if I do, that means this is not what I'm going to see. How do you learn this? That's the fundamentals. When you're reading about pericarditis or appendicitis, no unexpected finding for that condition. That means if I say appendicitis, you should know what are the things you're supposed to know. If I say aortic stenosis, what should you know about it? If you need it, subscribe to SATA NCLEX for more content like that. What do you think? Aortic stenosis, this is a suspected finding. They're supposed to have harsh systolic murmur. I put it there to trap you. This is what the NCLEX do, NCLEX trap. They will take the condition and they put the words that you know is there. Look concerning, but this is what you're supposed to do. They're supposed to have harsh systolic murmur at the right sternum upper border. expected finding. Ignore it. But when they have chest pain, that's exertional chest pain. That's bad. You're going to have syncope. They'll die. Aortic aneurysm. I did not say it's ruptured. The blood pressure is fine. It's pulse pressure. It's okay. More than 25. We're not going to pick this patient. Coronary disease should avoid what? Sumatriptan. Sumatriptan causes ischemia. You cannot use it in this patient. The nurse should do something about it. If you have coarctation of the aorta, blood going to your leg is low. So when you're walking, you're going to have pain. Expected finding. 2 answers. Cardiology, prioritization, and selected apply. What do we see? This patient and that patient are people we will see. Which finding are most concerning? Selected apply. And this is reviewing assessment finding for multiple clients with several conditions. Which one is concerning? A client with pancreatitis, amylase, 1,000. Client with glomerulonephritis, what? Tea-colored urine. Client with nephrolithiasis and hemophilia. A client with what? Colostomy and a severe abdominal pain with distension. Client with multiple sclerosis and what? Unilateral leg weakness. You know the strategy. You know the B-sharp. If you need more, check out that NCLEX prioritization strategy. Easy way. Expected or unexpected. But with that, there's a specific condition you have to know when you see it. You have to worry. That's what the B-sharp is about. It's more than ABC, but it's all about being sharp and not being trapped by expected finding. Pancreatitis, well, amylase is the diagnosis of pancreatitis. Why would you worry about it? It's supposed to elevate. If it doesn't, it's not pancreatitis. Glomerulonephritis, inflammation of your kidney. Well, blood cells will leak. Your urine will be tea-colored. If you have kidney stone, nephrolithiasis, there may be blood in your urine. I'm not bleeding. This is not shock. On the B sharp, we call shock. These are all not shock. This blood is not shock. Colostomy patients, severe abdominal pain, distension, obstruction. They can have what? Ischemia, sepsis. That's a problem. They will perforate. Big problem. Multiple sclerosis, neurological problem, unilateral leg weakness is an expected finding. You see, one answer choice. Over select, you get 0. Adapt NCLEX does not want you to have 0. So use this strategy. Which finding require immediate provider notification, prioritization, selected apply, NCLEX practice question, NCLEX review question, NCLEX questions and answers on nursing exams. This is all you need to master that. Client with what? Schizophrenia. What is he doing? Reporting auditory hallucination and agitation. Client with aortic aneurysm reporting what? Back pain. Client with heart rate of 48, but what? Who is a trained and endurance athlete. Client post cholecystectomy with the shoulder pain. Client with what? Hypothyroidism reporting what? Cold intolerance and fatigue. You know the answer. The way I read it, you can tell. But I just want you to use the strategy. Go back with the concept. Stop the video. Put your answer down. The best way to learn with this type of questions, stop it. Attempt to answer it. I will break it. The answer choice for you on why the other one is wrong. Then you see which mistake you make. Then you can correct yourself. Schizophrenia, auditory hallucination. They can have hallucinations. Visual hallucination, tactile hallucination, right? Olfactory hallucination, whatever. But if they tell you they can hear things, you got to find the content. So this one we got to see. Aortic aneurysm, having back pain, this is rupture, shock, B sharp. If you have heart rate 48, but he said what? Is a trained athlete. This may be normal. It does not need immediate right now. We may have to sit there and make sure they don't have symptoms. But there's a qualifying here. There's a reason why I put trained endurance athlete. NCLEX will do that to you. That means they want you to know, don't pick it. I'm qualifying the heart rate with something normal to the patient. He trained, like probably his heart rate is like lower than that. He's 48. He's in the hospital and his heart rate is a little bit high. 48 is low for you, but there's a qualifier. Don't let that be something you ignore. Cholecystectomy is supposed to have shoulder pain. Hypothyroid is supposed to be have cold intolerance and fatigue. 2 answers, A and B. Over selection, you miss more point. Don't miss point. Which assessment finding require immediate Nursing action, same thing. Digoxin, heart rate of 52 and nausea. Should that be what you should see? Acute glomerulonephritis with periorbital edema. Patient has crop is using humidifier. Fundamentals of selected apply and what? Prioritization. I want you to understand them. These are the little, I don't want to trap you, but I want to use these are little things, strategy when you use, no matter how they make the question, you can still figure it out. I'm taking insulin glargine, but I'm confused and I'm sweaty. Is that okay? I have nephrotic syndrome and my protein is +3. This should not be that something you let me trap you. Nephrotic syndrome. You're going to lose all your protein. We see it, but change the words. That's what the NCLEX will do. They change the words in it. Proteinuria will lead to edema. This is the same thing. If you take glargine, it's the same thing as insulin. You can have confusion, diaphoretic hypoglycemia. It's in the B sharp, which is what? The H, hypoglycemia and hypothermia. Croup, we're treating him with humidifier. Okay. Glomerulonephritis, injury to your kidney, you lose protein, you have periorbital edema. Digoxin, GI symptoms, and what? Bradycardia, bad problem. Both are all bad combination. It tell you we have toxicity. These are the two patients we got to see. Number 8, which client require priority assessment. That means it's the same thing. You see first whether they remove the first day or not. It does not matter. It's priority assessment means you pay more attention to them than the rest of the patient, even though all the other patient needs something to be done. And then it's beginning a shift and review assign client. Selected apply. Which one need priority assessment? The client is 36 weeks gestation, blood pressure 160/110, and complain about headache. Client with nephrolithiasis, he has what? 7 out of 10 chronic pain, and there's blood in the urine. Client, is this that patient bleeding? Client with COPD, he has prominent barrel-shaped chest. Should I do something about the chest shape? Client with hemophilia reporting knee pain and a sensation of the room is spinning. The room is spinning for him, and he has knee pain. He has hemophilia. A client with pericarditis reporting what? Chest pain during what? Inspiration. Who do you want to see? Who is in trouble? Prioritization 101. What do you think? Selected apply. SATA. Okay. Individual patient. Blood pressure 160/110 and a headache in a 36 weeks trimester. This is preeclampsia. Kidney stone, you're supposed to have frank pain and some blood in your urine. You know, bleeding and you are not in shock. COPD, prominent shaped, berry-shaped chest is what? Emphysema. Ignore it. Hemophilia, they bleed into their joint and they are therefore knee pain, bleeding. At the same time, I give you a clue. Room is spinning, hemorrhage. That's shock. Client with pericarditis is supposed to have chest pain. When you take a deep breath or you lay flat, it get better when you lean forward. Don't worry about it. Number 9, which client should the nurse assess first due to what? Potential medication-related complication, all right? Selected apply. And nurse is assigned to the following client during morning medication pass. Which one should the nurse assess first to make sure the medication is not causing problem? You have a 72-year-old, forget about the age, cancel the age. All I care about, client on warfarin with the dark, tarry blood stool, right? A 55-year-old with what? He's taking Gemfibrozil, is now prescribed atorvastatin. A client with what? Chronic pain is requesting his morphine medication. 40-year-old is taking lithium, his sodium is 128. Year-old client on digoxin with a heart rate of 62. What do you think? Who are you going to pick? Who is in trouble? 72-year-old adult, 60, it got to be less than 60, 62. It's fine, I'll pick it. No problem. Nothing wrong with it. Lithium, your sodium should be normal. 128, we have a problem. Patient has chronic pain. He's requesting his medication. Forget about it. You're not dying from it. Gemfibrozil, It's one of those fibrates. You should not combine it with atorvastatin. Watch for this. This is being asked multiple times. Combination of lipid-lowering medication. This one. Warfarin, dark tarish to you bleeding. Those are the patients who see it. So we have a bleeding patient. We have a patient that when you combine Gemfibrozil with atorvastatin, you have rhabdomyolysis. You have chronic pain, we have time for you. Lithium with hyponatremia, bad. Digoxin, heart rate of 62 is okay. And the last question, I want to know your score. If you get less than 9, I want you to watch this video again, see the strategy, and then I will link a video on prioritization and select apply to this video. It will be on the screen at the end screen, or check the cards on the top. Click on it, watch it and master it, or go to my channel, subscribe for more content like that. And next is reviewing medication-related concerns. Same thing. Which of the following clients require immediate follow-up? Select all that apply. Immediate follow-up. They may all have a problem, but one of them needs to be seen, or more than one. I take clopidogrel. You have to recognize what medication it is. Who report dark tarish too? I take amiodarone. I report dry, non-productive cough for a week. I take warfarin with a PT of 45 seconds, and I have small gum bleed. I'm on metformin. I'm scheduled for CT scan in an hour. And I take levothyroxine, and I feel jittery, and I have heart rate of 120. Like I told you, end of the question. Which one you think is trouble? I know you got it. This guy is bleeding. Clopidogrel is antiplatelet, like aspirin. Bleeding, black tarish too. Amiodarone with the dry cough is what? Pulmonary fibrosis. We got to see this patient. Warfarin with the PT of 45 is too high. Less than 35 is good. 11, between 11 to the 30, 45 is too high. Metformin with the CT, you need CT in an hour, you develop lactic acidosis. I got to figure out when was the last time metformin will be given. You may need IV fluid, everything. You may have to postpone the CT, but they can't have CT. And levothyroxine, if I give you, you become jittery. But with a heart rate of 120, probably have what toxicity related to the medication, hyperthyroidism symptoms. We got to see you. 5 patients, all of them need your intervention. Thank you for watching. If you like this video, click the like button and then write the small comment and share the video. Thank you for sharing also, and subscribe to SATA NCLEX for more content like that. Take care of yourself and good luck in your exams.